So, raise your hand if you are feeling anxious today. And if you're not, please raise your hand and let us know your secret. Okay, so yeah, that's a fair amount of us. What if I told you that practicing art therapy can help lower your stress levels, encourage mindfulness, and decrease your risk of developing dementia? So much more. That sounds pretty awesome, doesn't it? So what's the deal with art therapy? How do you get started? For the technique I'm going to show you today, all you will need is paper, colored pencils, oil pastels, and a journal to write your reflections in. Before doing art therapy, whether it's yourself or client-centered, you want to invite in some mindfulness. So let's do that right now. Has anyone heard of the 3-3-3 rule for anxiety? This is something I often practiced in the classroom as a preschool teacher, as many of my kids were dysregulated throughout the day. The 3-3-3 rule involves observing 3 things you can see, 3 things you can hear, and 3 things you can touch or move. This is a great grounding technique for all ages, and it helps you manage intense emotions by steering the mind away from your anxiety into the present moment. So right now, I can see a desk, the floor, the light. I can hear the fan. I can hear my finger tapping. I hear the squeaking of a chair. I feel the smoothness of the podium, my feet planted firmly on the floor, and I feel my breath moving in and out. Now that we have become more mindful and grounded in the present moment, let's dive into making some art. So a lot of us have a hard time describing our feelings, and that's perfectly normal. Art therapy is the bridge to communicating our inner world. Let's start out by drawing a simple circle. Ooh. Here we go. There's our circle. So, it doesn't need to be perfect. Just allow whatever comes on the page to be without criticizing it. Now let's imagine the anxiety that we feel is visible. Imagine it's made of shapes, lines, colors. What would your anxiety look like? Maybe it's big or small, heavy or light. Simply allow the image to come to you. Now that I have an image in my mind, I'm going to transmute this anxiety onto form, onto paper. Try not to criticize yourself. Let whatever comes on here just be. Add some swirls here. All right. So, there's no right or wrong way to do it. Now that we have our image, we are going to do a bit of reflection. Let's answer the following questions. What do you see in this image? If this image could talk to you, what would it say? And what would make this image feel a little bit better? So to answer this question, I see a jagged mouth, open and ready to consume. The message that this image is communicating to me is that my anxiety feels all-consuming, and it takes over my entire body. I would alter the image by softening the edges, maybe adding a little bit more color, and maybe transforming it into a flower garden or something with a little more life in it. What we just did was take the power away from the anxiety by giving it a name, color, and form. We often think that by ignoring our intense emotions, that they will eventually go away. But this approach actually has the opposite effect. By facing it head on, we make space for it attending to a young child who craves attention. Once it feels heard, its cries diminish. This practice of reflection we just did is a bit like a Rorschach test. For those of you who don't know what that is, a Rorschach test is often used to examine personality characteristics and emotional functioning based off of what they see in an image. So my art therapist, Christine, and I, we have often done similar examples of this in session, such as this right here. There you guys. In this image, when I first saw this, I saw two men screaming at each other, and my therapist, she saw two mitts that were coming to each other in a loving embrace. I think it's interesting how wildly contrasting our perceptions of the world are when we identify with art. So what do you see in this image, and what does that say about your inner world?